welcome to another Health Mastery series here at Dr. U. My name is Dr. Achmed Kamara. I'm a UK general practitioner at GP. What I want to talk to you about today is doing a home blood pressure monitoring. So this is extremely useful in making the diagnosis of high blood pressure or hypertension in the first place, or actually in monitoring your blood pressure and helping us to make treatment decisions. Okay, so when someone is anxious or has just run or had a coffee or just done some exercise or just nervous coming to see a doctor or nurse in clinic, their blood pressure may be high as a result of that, and so we may not be getting a true reflection of their true usual underlying blood pressure reading. And we call this a white coat effect. But you can have situations where, despite however many times someone comes to see the GP in clinic, despite however comfortable that relationship may be, they're always just a little bit nervous. So if their blood pressure reading is persistently raised every time they come to clinic, we may be making a treatment decision that's not accurate. Okay, so I said it's useful in making that diagnosis and monitoring. So when someone is in that situation where they have persistently raised blood pressure, in order to be sure that they truly have hypertension, we can do one of two things. One is to organize something called a 24-hour blood pressure monitor or ambulatory blood pressure monitoring, and it is as it says. They have a blood pressure cuff put around their arm. They have a small device that's actually easily concealable, so they can go about their daily activities without disturbance, and that's what we want. We want to get your blood pressure reading when you're doing your normal daily activities, and throughout that 24-hour period, the machine records your blood pressure intermittently, and you return it after 24 hours. The figures are downloaded and an average is worked out. Now, we can get just as useful information from a home blood pressure monitoring. So this means you do it yourself at home. But of course, you need to have a blood pressure machine. And I've got an example here. Okay? And the importance of whichever blood pressure machine you have is the cuff size. Okay? Most devices will give you a figure. So you can see this one here says 34.3 to 50.8 centimeter. That's just telling you that it will be fine for an arm size of between 34.3 and 50.8 centimeters. And it's important, there's something on the machine called the diaphragm. It has to go around your arm, at least 2/3 of the way around your arm, but it mustn't, double over. If it's too small, you get an underestimate. If it's too big and you're going over the diaphragm more than once, you're going to get an overestimate. Okay? So that's the first thing. Now, how do you do a home blood pressure monitoring? So it's very, very easy, very straightforward. You do 2 blood pressure recordings in the morning and 2 blood pressure recordings in the evening. A few minutes apart each time. And what's morning? Morning is any time from 6 a.m. to 12 p.m. Evening is any time from 6 p.m. to 12 midnight. So you record your 2 readings, and I normally either print out if I'm seeing the patient in clinic or send them a text message of a document like this or similar spreadsheet or table. This is from the British Hypertension Society, and you can see here you've got the date, you have the time, you have your systolic blood pressure recording, so that's the top reading, the higher one. You have your diastolic blood pressure recording, and then you have notes. For example, have you had just coffee before recording it? Were you doing a lot of exercise that day? Were you anxious? Did you have a stressful day? Did you have any change in medications? Because that helps us interpret which figures we use in your average, but also how we interpret that average reading. Okay, so that's really useful. Now, sometimes you may do one recording and then the second reading is vastly different. Let me give you an example. Let's say your initial recording is 140 millimeters of mercury systolic, and then you do your second reading a few minutes later and it's 180. Now that's hugely different. You're not going to get the same reading with every time you record it, but it should be your systolic should be sort of within 5 to 10 millimeters of mercury of your previous reading. Okay, if it's more than 10, I would say that's usually too great a difference. And then you're then advised to do a third reading on that occasion, and you take the 2 closest readings and note those down. Okay, you record these 2 in the morning, 2 in the evening, over 4 to 7 days, so that we get enough numbers to be able to work an average. And I tend to advise my patients to do it over 7 days, because the more numbers you have, the better your average is, the better reflection it is. I use home blood pressure readings for making diagnosis. I also use home blood pressure readings for monitoring patients' blood pressures at home and making treatment decisions. It is really important that we make a diagnosis or we make a decision to alter your treatment based on the best evidence, not just a random one-off reading. Okay, there are exceptions to this, and this is not the purpose of this video. This is really just to explain to you how to do a home blood pressure recording. So once you've done your reading, you submit it to your GP. You can either do this through email, or we have text message facilities where you can send photographs of your recordings. Some devices at home actually can be connected to a spreadsheet at home that downloads the values and works out averages for us. You know, there are lots of ways of doing it. Like, you don't have to have anything complex. So that is home blood pressure monitoring. Extremely useful. It really puts you in control. It means also you can, you don't have to physically go disturb your day and go and collect a device for an HBPM and ambulatory or 24-hour blood pressure monitoring. And it also gets you involved in that decision-making process, because I always say to my patients, you've got to be a master of your health, and you only become a master of your health by being informed, by being involved and interested, and by taking part in the whole process about the decisions we make about your management. Have a great day, and hope to see you soon at our next Health Mastery series. Take care.